to realize that the two are very intricately linked. If you want to successfully treat mental diseases, then you obviously have to see yourself in existential role in saving humanity. That's also part of your job. And then he also says, knowing that the leg was broken as a result of a skateboarding accident has no role in treatment of the compound fracture. So what he's saying is, if there's a fracture, you don't bother about why the fracture occurred or how it occurred, you just treat the fracture. Now, I say, my argument is, how can you say the same thing applies to mental health, which is by nature different from other medical specialties? It is not even apt to have the analogy of a skateboarding accident for explaining why a psychiatrist is not concerned about the social environment that led to the mental illness. Indeed, if we were to twist this very analogy of a skateboarding accident, then it is imperative that we examine how and why the skateboarding accident took place, so that we can design better roads that will prevent such accidents, as we do also need to change conditions that led to the accident first of all. And it is only when we accept that such conditions need to be changed that we actually design roads that will prevent such accidents and thus reduce the possibility or elevate the possibility of such a thing happening again. We need to go to the root cause of things and eliminate or improve, for instance, the roads that were faultily constructed. Wouldn't that be a much better solution than allowing such a thing to occur and then treating the problem? So another doctor said, in reality, the treatment of affective disorder should focus on the disorder, not on the previous environment, unless we assume that all our patients are the victims. Now I say, there can never be an effect without a cause. The very Newtonian paradigm that psychiatry is based upon will be refuting itself in the medical context if it claims that all patients are not victims. Indeed, all patients are victims of deadly realities that exist, irrespective of whether or not we care to admit their existence. I give an analogy for this, to prove this, Ask the person who has experienced it. I may read a whole lot of books on how sweets taste, but unless I really eat the sweet myself, I will not know how sweets taste. In order to know how a sweet tastes, I have to actually eat a sweet. It will not matter even if I read tons of material on how sweets taste. So validation of subjective realities are the need of the hour. My reality is reality as I experience it, and is not what somebody else says it is, especially when that person lacks directive, subjective, experiential expertise. I'm trying to demonstrate, one thing is, there's another doctor who says, the role of environment becomes minimal when we focus on treatment of patients. There are two reasons. Number one reason, he says, we never know for sure what caused the disorder. So I say, do we never know, or do we not want to take the hassle of putting an effort to know on account of biased professional training or professional arrogance or whatever? He also says we cannot change patients' past, so why bother? I say we cannot change patients' past, but we can prevent the same past from becoming a present reality in the lives of several people in similar situations, if only we care to investigate things without wanting to put on an objective, cold, analytical front just to show our power over those whom we treat, the medical gaze, so to say. I have experienced this in psychiatry. We need to know what the experiencer has experienced so that we may find ways of preventing similar things from being replicated in the lives of other equally disadvantaged and thereby, in this sense, vulnerable people. And I can tell you from personal testimony that changing my environment is also that of 12 other women with this user support model I came up with led to our recovery. But for our activism, we would have been declared innately defective, locked in rooms for the rest of our lives, been at the mercy of psychiatrists who could have even raped us had they wished to, and treated us as mere bodies to be examined. And I have worked in several asylums where psychiatrists, owing to their claims of objective analysis and explanations of illness, discount the realities of clients on the pretext that they have cognitive distortions, that they will not improve no matter how much you help them with non-medical alternatives, that they live in a delusional world, and they cannot have, they cannot have much help, that they have no insight into their problem, that only a medical breakthrough can help them. I can quote sagas upon sagas of the professional brutalities I have experienced, and had I not decided to find my own way out through activism without relying too much upon doctors, my life would have been a perpetual mess. And then, there are other psychiatrists who say our job is to treat patients. Other medical specialties do that, why can't psychiatrists do the same? I say, because the realities of clients who come for help with mental problems are totally different from the realities of other patients, as you would like to call them. Psychiatric illnesses are far more stigmatizing, crippling than other diseases, and can easily cause a civil death. Preventing the clients from having a civil death demands that we also simultaneously focus on the betterment of society. The nature of the client's psychosocial handicap demands that psychiatrists also focus on societal betterment, which will solve a multitude of problems, my own life as those of several other user, consumers, and survivors. Best testimony to this. And then, also, we don't have absolute conclusive genetic studies to confirm that schizophrenia is caused by inheritance of faulty genes. Studies on environmental role modeling have negated many of these so-called scientific genetic studies, which are more a reflection of professional negativity than anything else. These people said I would not even succeed in becoming a graduate. I recovered and went on to complete my PhD in women's mental health. And these people could not even offer a valid explanation as to why their professional predictions had totally failed. Now, also, I have a very strong argument. I should be ending within a very short time. I have a very strong argument about whether schizophrenia runs in families because of genetic inheritance or not. I say it doesn't. How do I say this? You see, if schizophrenia were to be genetically inherited, then the identical twin of somebody with schizophrenia would always have schizophrenia, but research has shown that this is not the case. Let us take into consideration, however, two identical twins. To start with, they have exactly the same genes, but when you put one of them in a pathological environment, she develops a mental illness. And when you put the other in a very nurturing and conducive environment, she becomes an achiever. So when genes are exactly identical but environments are different, individuals grow up and develop into totally different personalities. If you want to prove, on the other hand, that environment is what causes schizophrenia, this is not different, this is a corollary to what I just said now. If you want to prove that environment is what causes schizophrenia, you need to have two people with the same genes but different environments. There have been umpteen studies to prove this. However, if you want to prove that faulty genes are what cause schizophrenia, then you need to compare two individuals with different genes but having the same environment. Now, the crux of my argument is this. Two sets of genes, okay, can be exactly the same, but no two environments can be exactly the same unless the two individuals compared grow in environments that are laboratory controlled for all variables. And even twins grow in societies and not in laboratory controlled environments. And so how can two environments be compared? Meaning, how can you compare the two environments that the twins have had? If the identical twin of somebody with schizophrenia has not developed schizophrenia, then it is simply because the healthy twin has had some sort of an environmental buffer that has prevented her from succumbing to schizophrenia. Consequently, the twin sibling of this healthy twin has developed schizophrenia because she has not had the environmental buffers that had prevented her twin sister from succumbing to schizophrenia. There would have been some differences in their environments that would have contributed to the difference between the twins. My point is simple. Two sets of genes can be exactly the same, but no two environments can be exactly the same. So how can you thereby compare the two environments that the twins have had, and say they are the same, and that genetic vulnerability has thereby been a cause of mental illness? Also, there was one more psychiatrist who said, in psychiatry, we don't treat patient population, we treat patients. And since we cannot tell how environment does it, and to whom, we should focus on the patient and not the circumstances. I will say, obviously you're right. You have not been able to say how environment is responsible, and thereby you have chosen to evade the challenge of establishing a link between environmental influences and schizophrenia. You are trying to avoid putting in work by glossing over the issue and saying we do not know how something happens, and we should thereby not focus on finding out how it happens. Sheer psychiatric escapism, which is so typical of psychiatrists. My experiences with the psychiatric system have also confirmed this. Yes, I have a very, very authentic story to tell indeed. Also, lastly, these psychiatrists say, saving humanity should be done outside one's office. Many of them say this. Patients do not come to us to get lectures on better world. Calling patients' life horrific once again indicates that you envision the environment as the cause of diseases and that they strongly disagree. This is a shame, is what I say. A profession that takes upon itself the responsibility of saving a life cannot shirk from its duty and responsibility of rehabilitating the very life it claims to have physically saved, thus leaving the individual alone to die a civil death. And whether this person agrees with me or not, many other user survivors have come here along with me and are able to narrate what happened to us and what led to our disability, which we overcame but is still causing untold misery.